sounds perfect.
All right, good. So I'm joined today with Dr. Eric Yazel from the Clark County Health Department. This is the second time Dr. Yazel has joined me in a conversation, primarily to talk about COVID-19 and the impacts here in Southern Indiana, and specifically in Clark County, and what we can kind of do in Charlestown to help during this pandemic time. So thank you, Dr. Yazel, for joining us again.
And thank you for having me. Good to see you again.
Yeah, so we were together last time you came on. I think it was April 24th, and we were right in the middle of kind of the major shutdown. Businesses were closed, and I think at that point, looking back at my notes, our percent positive then on cases was at 15%. And that was one of those numbers that we were kind of watching at that time to see how things were going. I believe it even went up by May 1st. I think the highest that my records have it was May 1st at 18%, 18.1%. And then it kind of started going down. And of course, we have since then reopened large parts. The governor of Indiana has had a very strategic phased reopening. We are kind of hovering around 4.5 right now. So many of our places are open, but with restrictions. And of course, we're under this mask mandate right now out in public until the end of the month. So why don't you start off by just kind of giving us your firsthand experience of what you're seeing here in Clark County as you're treating folks and kind of being on the front lines?
Yeah, it's kind of interesting because I always try to not get too focused on what I personally see because I'm just one guy on one shift. So, I may see several cases on one shift and I may go another week without seeing one. But we kind of saw that same pattern in the emergency department, honestly, from, early May all the way up till the end of June. We kind of saw a nice decline. And then once July hit, it kind of started to head back the other direction and has since kind of plateaued off. But, we got down to where we just had a couple hospitalized COVID patients in June. And it's gone back up to the teens pretty consistently now. So we are seeing more of it. It does seem to be like a lot of other locations, our younger, more mobile population. So, travel and events and things like that may be some of the factors behind why we've seen some increased activity. Our priority right now is, to make sure that patient population stays healthy, but also to make sure that we're preventing transmission to our older at-risk population and things like that.
Sure. So talk to us a little bit about the change in the population that you saw. So one of the things I know you and I have talked about is watching that percent positive and how it's down right now, but comparing the percent positive today for the population we're testing really doesn't offer an apples to apples comparison with the tests that were being done in early April or mid-April. So talk to us about the population that you're seeing primarily here.
Yeah, a couple things that are important, I think, and I've always followed the percent positive too, but there are some things now that make that a little more inaccurate. Two things. Number one, we have now 5 months of data, weighing that down. So a very small change in our percent positive can actually be really significant. Back in March and April, we'd see these big wild swings, and we're just not going to see that anymore with that much data. And then number two is, the testing scenario is totally different. Back in March and April, you had to be symptomatic and sometimes very sick to even warrant a test. Now we're testing a lot of even worried well and things like that, and our testing rates are up. So that does dilute down our percent positive rate. But we try to watch those trends over the short term versus now the big long-term picture. And we actually are able to get a little more finite data. We have it broken down by zip codes and things like that as well. So that helps us to identify, more specific target areas within the counties.
For people like me who are in positions of making decisions, so for all of our business owners, our school leaders, our municipal leaders, those types of folks, or for the people who just really like to follow numbers and are kind of data geeks like some of us are, what can we watch? Like when we pull up the state site, and the Clark County site is now providing some information all on their own too, the health department, right? You're providing your own data now. So talk us through what we're looking at when we pull that up and what measures we can watch to kind of get a feel of where we are.
Yeah, so we do get almost all our data from the state heat map that they have. But we've just gotten a lot of calls of, can you put some out, something clear and concise that helps us guide us on what to look for. And basically what I watch is the curve of, how many positive cases do we have and how many tests do we have. And if we start seeing that get out of proportion to each other, that tells you that something's going on. We watch our hospitalization rate because obviously that's a big indicator of severity there.
Mhm.
And those are kind of the main things we look for. I will say, if you watch the testing data, that does lag behind a little bit because they get testing data from, so many different sources that it does take a while to get that. So when you see like our 7-day average of positive tests rate, that actually, I think today's is probably up through about July 29th. And that's why there's a lag time there. And then, we're doing things in real time as well. So when, right now we watch the overall patterns, but we're also very focused on, if we get a specific positive at a specific location, our first priority is to, get there and get with them and keep everybody safe.
Cool. How are we doing on supplies? I know that early on we were very concerned about personal protection equipment available at our hospitals, ventilators, that kind of stuff. How are we doing?
I think we're in good shape. We were able to stock up a little bit at the health department, so we'll hopefully be able to, dispense if a situation, escalates again. I've tried to encourage everybody to still, even though things seem to be a little, more stable that way, to be very judicious of your PPE. I'll be honest with you, I don't think I've thrown a mask away since March, because there are areas that have they can sterilize and reuse and things. I haven't had to use those, but I do keep them on hand because I just never want to get in the scenario again where I'm worried about how we're going to protect our frontline staff and things like that. That just, when you can say it kind of surprised you, that's fine. But now that we know it's here, there's no excuse for that. So.
Sure. Talk to me a little bit about contact tracing. So that's one thing we hear a lot from the governor's office when he does his update stuff is contact tracing. So if someone gets diagnosed with COVID, what steps are we taking to kind of prepare for that initial spread from that one person?
Yeah. So contact tracing, basically, if you're positive, then typically you'll get a phone call or a text or something like that. And then when you talk to our contact tracers, they'll ask you where you've been, what kind of work do you do, who you've come in contact. And a lot of you have heard the magic numbers, within 6 feet for 15 minutes or more. And then those people will get a call as well and kind of tell them what to expect, what to look for, and things like that. And the whole goal of that is to minimize spread. Now, one thing that's it's a little different right now is the state of Indiana contracted with a third party to do that contact tracing. Just because, as you can see, if you do a 30-minute interview with somebody and then they have 15 contacts and that's, 15 more 15 or 30-minute interviews, that gets time consuming very fast. The downside to that is there's a little bit of lag time between communication between the third party contact tracers and us at the local health department. So when we find out about a high risk exposure, one of the best examples have been in some of the school cases that we've seen, then we actually do it simultaneously. So you may get a call from somebody local and you may get a call from the state contact tracers both. And just kind of two different processes, because for the local thing, we're looking for, okay, what do we need to do right now today within the hour to keep everybody safe? And, and they're thinking more big picture, not just within the schools, but spreading the community as a whole.
Okay, so you've opened that can. So let's go down. Let's take that. Schools. So schools here in Charlestown started back up last week. So it's been a week now. It's been Wednesday. We've had a full week of open. And many parents chose to accept the virtual option and keep their kids at home. And one thing we've tried to do is stress that it's a personal choice. You do what's right for your family, you do what's right for your children and for your circumstance. And so a lot of people did choose to take that virtual option. It seems like some people sent them initially, and I've seen, if social media is accurate, I've seen some folks back off of that and say, well, no, I've changed my mind, we're going to go virtual. And I think the schools have set a deadline for, I believe, this Friday to kind of lock that in for the first quarter, to say whether you're going to do virtual or you're going to be in person. We need to know so we can be prepared. And then since school started, I believe, if I'm accurate, we've had a positive case at 3 of our 4 Charlestown schools. So we've had a high school student. Yesterday, I think they announced a middle school student. And then there was a staff member, I believe, at one of the elementaries at Pleasant Ridge. I haven't heard anything out of Jonathan Jennings. So What can you tell parents and guardians who might be really worried or stressed about how things are being managed at the schools?
It's a really tough decision right now. And one thing, first and foremost, I want to tell everybody is to be respectful of everybody else's individual decisions, whether it's virtual, in person, whatever you decide. Every single home has their unique scenario inside their home. If you are a child who's raised by grandparents or those with more at-risk conditions, you may choose to be more conservative. They're just different scenarios that everybody has individually, so there's no right or wrong answers here. It's what's best for your child, what's best for your family, and we ask everybody to be respectful of that. I think that's very important to understand. Our local data is such that we are seeing some cases in our young population. We've seen some in the schools thus far. What we're capturing right now is just community prevalence, though. I mean, if you rounded up 100 people and tested them, 5 or 6 are going to be positive. What we're trying to minimize is any kind of in-school spread, and I think that's very, very important. So that's why you see that there's been a case in school A, and as a result 20 people have been quarantined. We're trying to prevent that spread is what we're trying to do. And I know with some of the data, I see both sides of it. Some people think we're being too conservative. Some people think we're being too cavalier. Honestly, what we're trying to do is probably the right answer is somewhere in the middle of that. If we're too aggressive, then we're putting people at risk. If we're too conservative, sometimes the secondary effects of what we've done actually end up outweighing what we're trying to protect. So, we're just trying to navigate it as best we can. And again, I think that, just be patient with your administrators as they make some really tough decisions. And we're working with them every day. And, I'd walk through Charlestown High personally on Wednesday. They had great precautions in place. They've done a great job. So, what I want people to understand is a lot of these have nothing to do with how the school's handling it. It's just, what's out there in the community. So.
Right. I mean, it is a virus. It's going to do its thing,
Yeah.
right? I mean, we try to predict it. We try to control as much as possible. But I think the lesson for 2020 so far has been patience and adaptability.
Yeah.
Asking
Absolutely. It seems like every decision is what's the lesser of two bad or better of two bad options. It seems like what the decision making has been.
Absolutely. Let's talk through. So this is my favorite thing. It's kind of like debunking some of the things that you see on social media that get spread around, right? Or just addressing people's overall fears and things like that. Let's talk masks. You see everything from, masks being the saving grace for COVID and getting us through to masks being, damaging and horrible and, all this stuff about, decreasing oxygen availability for wearers and things like that. What does the medical science tell us about wearing masks?
Again, the answer is a little more in the middle than people are going to want this to be. Masks are good. They help prevent spread. Are they 100% perfect? Absolutely not. But if you get high compliance rate of mask wearing out in the community, it's going to slow the rate of spread, period. Are you going to be 100% protected, especially if you get into high risk environments and things? Not necessarily, but in general, you're going to see a lot more community spread. So yeah, I've seen some of the same articles where people are like, it doesn't work. And it does. It's not a perfect science. On the flip side of things, there are some people who have breathing problems or other medical conditions that make mask wearing problematic. For the average person, it is very safe to wear a mask for as long as you require to wear it. I'm ER now. I wear a mask my entire shift. I know general surgeons who have worn them for 18 hours straight on long cases. I mean, it's something that we in the medical community have always done in certain sterile environments. So I can assure you it's safe.
Well, and I think one of the things that I try to help, spread the message about masks is, right. So one of the arguments I hear about not wearing masks is, someone says, well, if you believe that your mask works, then you don't have to worry about me wearing a mask, as long as you're wearing a mask and your mask works. And so I think one of the myths that we have to tackle there is that me wearing a mask doesn't mean that the particles and the virus won't find a way in, because it's not a perfectly sealed, I'm not pretending that the virus can't get through my mask. Mm-hmm. I think what the point is that me wearing a mask means that if I have the virus, especially if I'm asymptomatic, which many of our cases are, I don't know that I have it because I don't have any symptoms. it helps limit the spread of that because it's keeping it more contained close on my body and less out into the atmosphere. I mean, isn't that why surgeons wear masks? I mean, they're in a sterile environment. They're not catching anything in a sterile environment. They're trying to keep from spreading, right? So,
Right. There's a couple things of that. Yeah, because, number one, people may be completely asymptomatic and, not know what their scenario is. And number two, one of the ones I always see is the guy, I forget, he's doing some sort of construction project and he takes off his mask and he's still got a lot of dust and things like that. Well, if he didn't have his mask on him, he'd be covered. And one thing that we're finding is it is the load of virus that you intake that increases your rate of transmission. So even if you've got something on that's, absorbing 75, 80% of it, the chances of you getting a viral load enough to become positive are much, much less. So, we're not trying to tell you that it keeps out 100% of every particle or anything like that. What we are saying is in a majority of cases, it keeps out enough to get you from becoming positive.
sure. Okay, what about touch surfaces? So this is another thing. So when March, when we first really started taking precautions, there were a whole lot of mixing, sanitizing wipes and Lysol spray. It was almost impossible to get anything like that. We're concerned about passing things out to one another and that kind of stuff. So especially for folks who are in school environments or office environments where you kind of have to pass, papers back and forth and touch surfaces. What can you tell us about how the virus spreads or the fear that we have to maybe manage or how we can best deal with the touch surfaces?
I do think that's one thing that's kind of changed over time. I remember back in March and April, I would get questions about, people would literally have like tweezers to get their newspaper out of the mailbox and things like that. And we didn't know, back then. And, there were some studies that showed that it lived for a significant length of time on certain surfaces and things like that. What we found in the interim is, while that is true, the chances of you getting enough of a viral load from touching those surfaces is probably pretty minimal. That being said, it's still, it's still a good idea to wipe things down as best you can, maintain good sterile technique, good hand washing, things like that. All those things that we've been preaching to you from the get-go are still very, very important. But, we do say that, the risk of transmission that way is much less than we originally thought.
Okay, good. And then also I wanted to talk to you about symptoms because this is one of the things that makes dealing with COVID-19 almost impossible. Every symptom feels like it could be COVID-19. We're all in this unknown territory where someone shows up with a sniffly nose or a sore throat or, upset stomach and everybody, oh my gosh, do they have COVID, right? So what kind of recommendations are coming out of science and medicine to tell us when someone should get tested or when we should suspect that it's COVID, or what are the main symptoms that we're seeing now that we've had a few months with this virus?
Yeah. First of all, I'll start with a little just anecdotally what I'm seeing in our emergency department. And it seems like the symptomatology has shifted a little bit. Headache seems to be a big component of it. Headache with fever and real severe body aches. That seems to be kind of the case pattern we're seeing a lot of times now. Now, there are also 100 other things that can cause that. So I'm not saying you have COVID if you have those symptoms. That does seem to be one of the more consistent things we're seeing. A few weeks ago, the GI component of it was really high, a lot of nausea and vomiting and things. The respiratory stuff seemed to be predominant a little back in March and April. So the pattern seems to be changing. Unfortunately, like you said, that if you look at a checklist of the symptoms, there's really not much that isn't consistent with COVID. So, well, we want as much testing as possible. So, my kind of rule of thumb I tell everybody is if you think about getting tested more than a minute or two, it's probably worthwhile to go ahead and get it done. That probably tells you. And then, in the random sampling of Indiana back in June, I think 43% of our positives were asymptomatic. So, that's the thing is it's just a real bear as far as mimicking, other illnesses or no symptoms at all. And that's what's been the challenge for us.
Sure. Since we're talking about testing, we have a couple of testing options, right? We're still doing testing at the Clarksville facility. You want to talk a little bit about where folks can get tested and what that procedure looks like?
Yeah, so there are a lot of different areas that are testing. The Clarksville side is obviously the one I'm most familiar with because that's the state-sponsored site. So we don't directly do it at the health department, but we provide all their support. we've doubled the capacity there, and they're pretty routinely now doing over 300 tests a day. One of the nice things about the state side is, number one, it's a good quality, reliable test. And number two, it also has a reliable 48 to 72-hour turnaround. What we've seen in a lot of other testing sites that use some of your third-party vendors like your LabCorps and Quest and things like that, they're getting overrun with tests again, kind of like we did back this winter, to where the turnaround times are 5, 7, even 10 days. And obviously, if you care enough to get tested, you want your results back as soon as possible. There is some rapid testing capacity. It is a little limited because a lot of the rapid tests have been diverted to other hot spots of the country. And so I know, and that's a little bit inconsistent as far as who has it available, but I do know that I think North Clark has been doing some rapid testing. I do think Floyd Memorial has some degree of that, but I would verify that, and then I know there's an urgent care up in Seymour that I've heard that has a rapid test. Those are all unverified, but we get reports back. Clark has a few of them, but our capacity is low enough that we only can use those for our inpatient admits where a rapid COVID test would change the management there. So that's kind of where we're at right now. So.
Okay, good. Well, I won't take up a huge amount of your time. I try to keep my videos to 30 minutes or less. I don't like to bog people down. I'm so appreciative of the information that your willingness to just come on and talk openly about this. You've been really a rock star from the beginning. The community has expressed so much gratitude for your willingness to come out and talk openly about this, to share your passion for health with us and your knowledge. You were doing your daily dose of calm there for so long, and everybody was, I think people actually were, I know I was on Facebook looking for it every day. Like, where's the daily dose? I need to know where we are. I need to have and you stopped doing that on Facebook for a while, but I'm going to give you an opportunity here as we close out to kind of offer a fresh perspective on a daily dose of calm and say,
Sure.
What are the big takeaways right now that we're a few months into this? We still aren't quite sure where we're going, but it certainly looks like we're probably going to have some more. It's going to linger for a while. And so what do you want to say to the folks around here to help us get through the next few months?
One thing I want to say is, we're all tired of this. Everybody's, so many things that all of us like to do have been, taken away. And, there's a lot of anxiety, there's frustration and things like that. And I think back in March and April and May, we did a great job of turning some of that anxiety and things into positive things out in the community. We tended to focus on helping each other and, doing a lot of great community things. And honestly, I think over, the June and July, we've seen a lot of that start to manifest itself more in anger, a lot of keyboard warriors and things. And, it seems like everybody's divided either, COVID's a hoax or it's, that we're, being way too risky. And it just, what I'd encourage everybody is, again, chances are the right answer is a little more down the middle. If we're too aggressive, we're putting people at risk. If we're, too cautious, then the secondary effects outweigh. And so just be patient, turn some of these frustrations into positives. You'll be surprised about how, if you get frustrated over something you see on Facebook and things, go out and help somebody instead of firing back. Let's try to bring that community together again and work together and do some of those amazing things that we were a few months ago. That's what we need right now. And then just to strictly follow the guidelines and navigate through this together. We try to operate at the health department with full transparency to, tell everybody the data that's out there and try to make the best decisions we can, explain why we make the decisions. You a lot of times won't agree with the decisions that we make, but understand that we do it with the best intentions and, with no pressure from external sources or anything. We just are day in, day out doing what we can for Clark County. So.
Excellent. Well, we all certainly appreciate it. So thank you again, Dr. Yazel, for coming on and talking us through some of this, giving us an update. Thank you for your dedication to continue to update us throughout this process. I still think we got a long road ahead of us, but I reiterate the need for patience and compassion from everybody. I can tell everybody that from the city side of things, we are making sure that we're being as adaptive as possible. So while we are mandating physical distance at our public meetings, we've taken a lot of steps to put those meetings online so that everybody can watch them safely at home. We take in public comment by email so that folks don't even have to come to the meeting to have their voices heard. We're trying to make sure that we're creating opportunities to listen and also react as much as possible from a safe virtual distance. We're also working on some plans to just go ahead and adapt some of our fall activities that we would normally do and just say, you know what, we're not going to plan that this is going to be a normal year because it's just not. So we're going to shake things up a little bit, and we're still going to have fun. We're still going to have community spirit. We just need to do it from a safe 6-foot distance for a while. So
That's right.
we certainly
Absolutely.
appreciate you, and we wish you the absolute best, and hope that you're watching out for your own safety as well and for your families. And of course, we also appreciate all of your staff too. We know how hard all of you guys are working, and we're grateful for you. So thank you so much, Dr. Yazel, for joining us again in Charlestown, and we look forward to continuing to see your updates.
That sounds great. Thank you for having me anytime.
Okay, have a wonderful day.
You too. Take care.
Thanks. Bye.